Right, good morning everyone, and welcome to a surprising venue in many ways, Jose Luis is going to come and explain some other venue news very shortly, so pay attention and have a pen ready to write down complicated instructions, which are not of course complicated at all. It's a great pleasure to introduce this session on the workforce. I'm Jill Mantle from the Social Care Workforce Research Unit, so this is the session that I've really been waiting for because this is going to answer all my questions for years to come. And it's a great pleasure to introduce our first speaker, who is Tim Muir from OECD Health Division. Tim knows the UK scene, but also, as you can expect, every other scene too. No question. So we very much look forward to hearing about his work. And Tim's going to speak for about 15 minutes, and then we're going to move to our second speaker, and then hopefully we'll have time for questions and discussion. So without further ado, we'll kick off, but if you are escaping, remember that there are going to be some instructions about where the next venues are going to be. So hang on around. Thank you, Tim.
Okay, thank you. So my presentation is going to just be a short overview of workforce issues across OECD countries. Is there a microphone on? What's this? That's a recorder. Do I just have to shout?
So if you just put it on yourself, and then I should be able to switch it on. So.
Is this good?
Yeah, that's fine. Do it for you.
Okay.
Yeah, if you just put it in your pocket.
Yeah, okay, pocket here. That'll do me. Is that a suitable place for it?
Okay.
Oh,
all right.
Okay, it's working. Okay, so I'm just going to give a fairly brief overview of the issues that OECD countries have around the long-term care workforce. It's going to take about 15 minutes, and then Matthias is going to follow and give some more specific details about the German case. So, long-term care, as we all know, is a labour-intensive service. Is this? Well, we all know it's a labour-intensive service. Especially when we're talking about community care, it's often something that's delivered by one person to another. And to date, we've not really found a way of removing or reducing that human input, and it's actually not clear that that would be a desirable thing to do. So meeting the long-term care needs of any population is going to be hugely dependent on having the right workforce in place. And the right workforce means... Is anything still working? I'll just shout for a minute. We on? Yeah. Oh, we're on. Yeah. Okay. So the right workforce means two things. It means having enough people to provide the amount of care that's needed. Which one off? I'm okay. Okay. Right. So it means having enough people to meet the long-term care needs of the population, and it means these people having the right skills and training. Now, in this talk, I'm going to mostly focus on that first question, which is getting enough workers into the workforce to meet our needs, which is a big issue for many countries. But as we'll see, the two things are not entirely unrelated. So I'm going to look at three questions. First, what does the long-term care workforce look like now? Secondly, how will the workforce need to change in the future? And then finally, what sorts of policies can help countries to meet their future workforce needs? And to explore these questions, I'm going to draw on the data that the OECD collects from countries on long-term care workers, such as it is. It's fairly limited, but we do collect some reasonably comparable data. And some of the international literature on this topic, some of which will, I'm sure, have been written by the people in this room. So all questions direct to the authors, please. Okay, so the first question, what does the current long-term care workforce look like? I'm going to start with a few sweeping generalizations about the long-term care workforce, some of which I will hopefully go on to substantiate. So care workers are mostly women, and that's true across all OECD countries. Around 1 in 4 is a nurse, leaving the other 3/4 as lower skilled personal care workers. There's a high rate of part-time work. In some countries, I've seen statistics along the lines of 40% of the workforce works part-time. Migrant workers are an important part of the workforce in many countries. And long-term care work is often characterized by low pay and fairly tough working conditions. Okay, so here's our most basic piece of data that we collect on the long-term care workforce. This chart shows how many long-term care workers each country has for every 100 people aged over 65. This is reported to the OECD by the relevant government ministries in each country. We do need to treat the figures with a bit of caution, because in principle this should be all of the long-term care workforce, including public and private, but it's not always easy to count people who aren't in contact with the public system. And in some countries there may be people employed as long-term care workers who aren't even declared to tax authorities, let alone in the health ministry's statistics. So there will probably be some underreporting here, but I think the main point from the chart is correct. There's a lot of variation in the size of the workforce between countries. But it's not just the size of the workforce that varies, it's the composition. So this chart splits the total workforce between nurses and personal carers. In most countries, you can see most of the workforce is lower skilled workers, personal carers, that's the lighter bars on the top. But there are a few countries, like the US, Switzerland and Germany, where it looks like most of the workforce is made up of nurses. So this is going to have some implications for cost and recruitment, but also possibly for the quality of care. Another thing that varies, of course, is what exactly we mean when we say nurses or personal carers. So this chart here is based on some research that my colleagues did a few years ago, and it looks at the number of years of training that personal care workers undergo in different countries. And this is again, information that was given to us by the ministries in these countries. And you can see that in Japan, personal care workers might train for 3 years. In Denmark, it might be something like 1.5 years. But in the US, they only need to train for 75 hours. So again, big differences in terms of cost and recruitment, but also potentially differences in terms of the quality of care provided by these people. Finally, something that doesn't really vary much between countries is the gender makeup of the workforce. In all OECD countries, nearly all long-term care workers are women. In Spain, around 20% of the workforce is male, but that's about as good as it gets. In the Netherlands, it's down at about 6%, so that would be a fairly unsurprising statistic for you. Okay, so how do we think the workforce is going to need to change in the future? Well, one thing that I think most people think is that we're likely to need more long-term care workers in the future. And the reason most people think that is that most people think that demand for long-term care will probably increase. I'm not going to talk about this very much because Emily Grundy already covered this yesterday far better than I could now. But there's quite a lot of uncertainty about future demand, but most people think it's going to go up. And it's certainly something that we need to be prepared for. And we probably shouldn't rely, at least in the longer term, on informal care mopping up that additional demand. So while there's quite a lot of uncertainty, it seems likely that a lot of countries are going to need to be prepared for the fact that the long-term care workforce might need to grow. The other way of looking at this question is to ask how the workforce has changed in recent years. So in some countries there has been really significant growth in the long-term care workforce, well beyond the growth of other sectors of employment. So these charts show the growth in long-term care employment, and that's the solid blue line, and the growth in total employment, and that's the dashed line in 4 countries, Germany, Japan, United States and Israel. And Germany and Japan really stand out here. In Japan, the workforce has more than doubled over the last 15 years. There's no reason to believe that these trends won't continue. It's not certain, but you'd be wise if you're living in these, if you're running the system in these countries, to expect further increases in the future. But the picture's not actually the same everywhere. In Nordic countries and the Netherlands, long-term care employment has basically followed total employment over the last decade or so. It's notable that all these countries have something in common, and that's that they have very comprehensive long-term care coverage. So there may be an element of some of the other countries catching up with these countries as people's expectations increase, or perhaps of these countries having to cut back a little bit to try and stem spending growth. But given that we think a number of countries may have to increase the size of their workforce, the question is, how can they go about this? What sorts of policies can help them to meet those future workforce demands? And it's not a straightforward question because a number of countries are already concerned about their ability to recruit and retain enough workers today. And it's not hard to see why. This is just a sort of selection of random statistics that I've picked up from the literature, but there are high vacancy rates, perhaps twice as high as in some other sectors. The duration of employment can be very short. Median duration of employment in the US was found to be 5 months or so in one study. And turnover can be very high, with something like a quarter of long-term care workers leaving their job every year. So these issues raise real questions about countries' ability to recruit enough people to meet increasing demands for care, but they also raise some questions about quality, which I think is quite linked to this issue. Because if no one stays in the job for very long, then are they going to be able to build the skills that they need to do that job well? So how can we improve our chances of meeting increased demand for care? Well, it's a pretty simple equation here. If you want to deliver more care, you either need to put more people into the workforce, you need to stop as many people leaving, or you need to squeeze a bit more out of each person you've got in there. So we can broadly group the policies that countries have tried and the things that are in the literature into these three groups. I'm going to show you just a few examples. I've not got time to go into any real detail of what countries have tried to do. And then Matthias is going to talk in a bit more detail about some things that have been tried in Germany. So starting with recruitment, how can countries get more people into the workforce? Well, one approach that's been tried is to target specific groups of people where they think the future workforce might come from. And this can be migrants. Migrants are already a very important part of the workforce in many countries. For example, in Canada, there's a scheme that grants migrant care workers permanent residence after they've been there for 2 years to encourage people to move to the country to take up care roles. In the US, there are tax incentives that are designed to encourage retired people back into the workforce and get them into caring roles. We already saw that men are hugely underrepresented in the long-term care workforce, and I am aware that Germany had a scheme at some point, I don't know if it's still in operation, to try and encourage young men to consider caring professions. And a few countries have looked at unemployed people. So the example on the slide is a Finnish one where there's a work reactivation program that got long-term unemployed people to help older people with their housework as a way back into work. But there are also examples of this in places like Japan and Turkey. Okay. Before I go any further, I should probably address a fairly obvious, glaring question here, which is it just a case of we need to pay people more? And we've already mentioned that pay can be low in the sector. In fact, the other day I was speaking to a friend of mine who works in the UK care sector. And in the care home where he works, they struggle to recruit people. And the people that they do have are leaving to go and work in Lidl. And for those of you who aren't from Europe, that's a cut-price supermarket. And the fact is, they can get paid the same amount for doing much easier work. And they don't have to worry about it at the end of the day. They don't have to take any concerns from their work home with them. So is that the solution? Is it just a case that people are underpaid? Well, a number of countries have implemented pay increases, although generally they've been by fairly modest amounts. And there is some evidence that pay increases work, as you'd really expect. But a US study found that $1 increase in hourly wages could increase job tenure by around 2 months. Doesn't sound like very much, but if the median job tenure is 5 months, then that's not too bad. And ultimately, I'm sure that if we increase pay by enough, the problem of recruitment and retention would go away. But when it comes to it, it's not clear who's going to stump up the extra money for these pay increases. Governments aren't currently in the mood to throw extra money at anything really, let alone long-term care, which doesn't often seem, unfortunately, to get to the top of their priority list. So pay increases might be part of the story, but we're probably going to need to look at some other strategies as well alongside that. And one thing we can think about is job quality more broadly. So there are various ways in which long-term care jobs can be improved that don't just involve pay increases. I'm just going to give 3 examples here. So in many countries, long-term care, it's a job, but it's not really a career. There aren't a lot of opportunities for training and development or for career progression. More of these sorts of opportunities could help to improve staff retention by making them more invested in their career. But many people in the long-term care sector work part-time, as we've already mentioned, and training and development is more complicated in a sector with a lot of part-time work. Another approach might be to give staff more professional autonomy and involve them more in management decisions. And this has been shown in some studies to reduce workplace stress and make people happier in their job. But in a sector that's characterized by having a lot of low-skilled staff, it may be necessary to provide a certain level of supervision to ensure the quality of care. So these things need to be balanced. The final example I wanted to give is the quality of care. So where staff feel like they're delivering higher quality care, it's been found that they're less likely to want to leave their jobs. Does that kind of make sense? In this case, I couldn't think of a but. It seems to be a fairly obvious win here, that if the quality of care can be improved, then that will also have knock-on benefits for the workforce. So the overall point, I think, is yes, we need to think about pay, but we also need to consider other aspects of long-term care work and how it can be made more attractive. So the final way in which we might be able to meet increasing demand might be to improve productivity. So when we talk about productivity, we basically mean getting more care for the same amount of money or for the same amount of staff. And I can think of 4 broad ways in which we might be able to do that. Firstly, we could just pay our staff less. I suppose that's been the historical approach in the sector to squeezing more out of the money we've got. But when we're worried about recruitment and retention, it doesn't necessarily seem like the smartest move. And in some cases, less would actually be below the legal minimum wage. So there really is nowhere to go. Another approach that's been tried in a few countries, including the Netherlands and the US, but I'm sure many more, is to delegate tasks to cheaper staff. So tasks that have been previously done by nurses would be done by personal care workers, and there may be other levels of delegation possible. Now, this seems like a way that could save money, deliver more for the same amount of money, if not for the same, if not for fewer staff. But we do need to be careful about the effect on quality and make sure that where tasks are delegated, they're delegated as appropriate tasks and there are appropriate levels of supervision. And there are actually care models that I've read about that take the opposite approach. So there's a model in the Netherlands called Buurtzorg that others may know more about that uses only nurses and claims to deliver savings over traditional care models. Oops, on this one. So a third approach we could take is to just try and take less time to care for each person. And this is something we do see happening in countries with episodes, like periods of care being squeezed into shorter and shorter bits of time. And this is going to mean that the same amount of staff can manage to look after more people in one day. But again, there's a question of what this means for quality. I've seen surveys of care users that say that their idea of high quality care is where the carer has time to stop and have a cup of tea with them. I mean, these are surveys from the UK, as you can imagine. And this approach of squeezing staff time could directly undermine what users see as the quality aspect of their care. The final one I wanted to mention is new technology. So there are, and I suppose have been for a while, great hopes that new technology is going to help us deliver long-term care more efficiently. And there are some success stories that I'm aware of. Electronic medical records in nursing homes in New York seem to have led to some time savings for staff. a voice communication system in Finnish nursing homes that seems to have improved productivity and reduced adverse events. But overall, the evidence that technology can replace human labour is pretty mixed. And there are a number of evaluations that have found that while there might be some benefits to using technology, it often actually doesn't reduce the amount of formal care that's needed. And it can be more of a complement, I suppose, rather than a replacement. So, my last slide is an attempt to boil this down to 5 bullet points. Demand for long-term care is going up, probably. Productivity increases aren't likely to save the day, unless we have some kind of incredible technological breakthrough. So we're going to need more long-term care staff in the future. Without better pay and or job quality, it may not be possible to attract enough people to the sector. And the bottom line is this is probably going to cost some money. We're not going to be able to solve these problems for free. Thank you.
Great, thank you very much, Tim. Shall we move on to Matthias and then have questions at the end?
Give me a hand with that. What do you?
So that one that clips onto you. The other bit just goes in. If you put it down, yeah, that's where you put it on.
Pop that in your pocket.
Can you? Do you know where the documents are?
This guy.
This guy. Okay.
And then down here.
Oh yeah. Thank you.
Up to slideshow.
Here we go.
Right then, just there.
Okay. Well, thanks a lot, and thanks a lot, Tim. We are working on the options, and I think you're right. That's what I can say. But it's a tough job. It's a tough job, and well, I want to start and give you some just a quick outline about the facts and figures in Germany. And then I want to show you a kind of, as we call it, holistic approach we are trying to with which we are trying to tackle the problem. I'll talk about the LTC insurance scheme quickly and about caregiving leave. Then I come to the geriatric care training and qualification campaign Tim talked about. And finally, the main bit will be the reform of nursing professions in Germany. It works. On average, people live 30 years longer today than they did 100 years ago. The proportion of persons aged 60 years or older rise from 26% in 2010 to 36% in 2000. Oh my God.
Just keep going.
I just okay. Okay. Don't worry about that. Already, persons in need of long-term care outnumber children under the age of 3 in Germany. And as I'm working in the family ministry, the other department is really angry about that, because I always say, well, my people, there are more of my people than of your people. In 2016, there are around about 2.7 million beneficiaries in the social and private long-term care insurance system. The need for action to ensure the care for the elderly and thus to ensure the skilled labor base in geriatric care is indisputable, and that's what Tim said. Surveys of the Federal Employment Agency revealed that in 2015, on average, 100 job vacancies were met by only 31 skilled geriatric nurses registered as seeking employment. So that means there were still 70 vacancies, and CEOs from service providers told me they have to close down living groups in their facilities for clients that they call them clients or not elderly people, for clients they had, because they had to close it down because they didn't have enough trained nurses. In the future, in 2030, we will have a shortage of 250,000 professional nurses in Germany, and that's a lot. So we are talking about a really severe problem. We are faced with the task of improving the situation of the professional field of nursing in view of the changing of care. That's another topic we have to face. Care structure in the nursing sector. This is especially linked to geriatric care. As an example, the proportion of elderly people and people affected with dementia in hospital is going up. In long-term care facilities, the complexity of nursing care needs is increasing. Models of outpatient care are enormously gaining importance for elderly people, but also for other age groups. Thus, in future, we will need well-trained, diversified professional caregivers who can be deployed in a flexible manner. We have to enhance and modernize care training, and that's, I think, what Tim said as well, and boost its attractiveness for men and for women, especially for men. And, that's what people want when they want to pick up the nursing profession. They want flexibility, that they are able to change, let's say, go from the LTC sector to hospitals, and they want choice, and that's what we try to give them. I'm not going to look back. We need a holistic approach to tackle the challenges. We need action, as I said, in several fields. So we reform the long-term care insurance, more resources for the insurance system. Secondly, we're strengthening family and voluntary care. We rely on them in Germany. Third, we're promoting the occupational field. And fourth, we reform the professional training programs and making them more attractive. Germany has implemented and is still discussing in this coalition period the last step of an extensive reform of long-term care law. The new law will add more than 5 billion euros on top of the current system, and that hasn't happened in Germany yet before. The reform will affect the wages as well for caregivers. I'm going to focus on the bullet point 224. Professor Rothgang, he talked about the LTC reform yesterday. So I come to my first bit, the caregiving leave. Without informal and family caregivers, we will not be able to meet future challenges. I think, for us in Germany, we say that people from Poland or people from Asia won't fix our problems. And it's not really fair that we attract people from Poland or from further east, because they need caregivers as well in the future. So we have to kind of go our own way. Professionals must team up with family members, volunteers, neighbors, and further assistants to take on care responsibilities in the context of a kind of care mix. We need a care mix to tackle the problem. In Germany, the bulk of care is still provided by family members. As I said, 2.7 million persons are in need of long-term care. More than two-thirds of them are cared at home. And the majority by relatives, more than 1 million. In fact, to remain in long-term care and to remain at home, that's what people want, and that's what many families want to give, to make happen to their relatives. As a result, relatives have to be supported, especially when it comes to reconciling caregiving and work, because they have two burdens. The reconciliation of long-term care and employment is becoming increasingly important. Many families are in a kind of sandwich position. On the one hand, they have to care for their kids, and on the other hand, they have to care for their elderly, for their grandparents. The Act on Caregiving Leave establishes the following statutory rights on claims. Temporary inability to work, they can leave up to 10 work days in emergencies to organize or provide adequate care during this period. This claim is supplemented by a kind of wage replacement benefit, around about 60 to 70% of the wage they normally earn. Then caregiving leave, part-time or full-time leave from work for up to 6 months, or part-time leave for up to 24 months to care for close relatives at home. Persons taking these leave are protected against dismissal, and they can get an interest-free loan, which is not much, but it helps some of them. To ensure that the demand for qualified personnel in geriatric care is met, the federal government started the geriatric care training and qualification campaign in 2012. As a strong joint initiative with a duration of 3 years until 2015, this first nationwide training pact in geriatric care faced the challenges for the field of training, professional and employment. On the basis of about 240 agreed measures, the goal was to enhance basic and advanced training as well as continuing education in geriatric care and to boost the attractiveness of the professional field. Among the most important target agreements of the campaign were, inter alia, the gradual increase of new staff starting geriatric care training by 10% each year, the boost in attractiveness of the occupational field. Many of the agreed measures had been implemented. For instance, the counseling team for geriatric care training of the Federal Office of Family Affairs, as a free of charge services, they informed about questions of geriatric care, and they tried winning over young people for the training as well, and as the organization of training associations and networks. So they got the young people into contact with associations and network. We had a positive trend in the number of trainees. The school year 2013-2014 marked a new peak with nationwide more than 26,000 new staff starting geriatric care training, and we met the 10%. But to be honest, we didn't meet it every year. Following up the successful implementation of the campaign, the 4 responsible ministries of the federal government agreed upon launching a new nationwide joint initiative of several years on the new nursing training and the occupational field of nursing. It shall comprise the entire present field of geriatric care, health and nursing care, so we made it bigger, and it shall kind of accompany the implementation of the reform I'm going to talk about. Now I come to the reform of nursing professions. With the reform having been prepared for many years, we seek to combine the training courses in geriatric care, nursing care, and pediatric nursing care. So we had, in the past, up to today, we had 3 kind of professional fields. We want to merge it into one. Closely linked to the reform are general modernization of the nursing training and the introduction of a new standardized nursing profession. We are creating the foundation for a new career a pattern which will meet changing needs of today. The reform of nursing professions addresses the background situation and the described changes by means of the following objectives: improve the quality of the training, increase the flexibility of deployment and the mobility of nursing personnel, boost the attractiveness of the training and nursing profession, and last but not least, have a wage adjustment. Because we have different wages in the different 3 fields. So geriatric, thank you. In the long-term care field, people get less money, and we want to, get it up. 81% of employees in the nursing field at hospitals are women. The proportion amounts to 85%, and that's, I think, what you agreed on as well, and 87% for outpatients as nursing services. Trainee trainees in male professions receive a training allowance. Trainees in female professions pay for their training courses often by themselves. This situation is unjust, and it will be abolished with a new act, at least for the nursing sector. We want to change. We want no charges for the trainees and appropriate allowances. There shall be a unified vocational qualification of Pflegefachfrau or Pflegefachmann, which means woman nursing expert or man nursing expert. So if you have a better idea to name the profession, please let me know. We are still discussing it. The old professional title may be held further on for people being nurses, which from my point of view is an important offer to today's nursing. They may exchange it for the new professional title. For the first time also, reserved tasks for the core for the core area of nursing will be regulated by the Act on Nursing Professions, like investigation and determination of care needs, structuring and management of the care process, quality assurance and quality development of nursing. These may not be performed by other professions, especially by physicians. We have a kind of a competition between physicians on the one hand and nurses on the other hand, and often the physicians win. So when we have reserved tasks in the future, nurses can say, well, that's my job, it's not your job, and that will strengthen the profession of nursing and support it. And I think that's will be very important in the future, and many associations say it's a good way. Now I want to talk about the structure of the training. In principle, the intermediate school-leaving certificate continues serving as a starting point for access to the vocational training. The facilitated exchange between individual nursing areas will open up numerous development prospects up to the nursing studies as an additional training pathway. We build new career pathways. Now, as before, the tried and tested principle will be maintained. There will be a dual basic structure with a training institution as the body responsible for the practical training. There will still be 4,600 hours of lessons, which are theoretical and practical lessons. The training will continue to extend over a period of 3 years for the full-time model. Just as before, the training will finish with a state-recognized exam. A new aspect is the encompassment of the entire professional field with more practical work, of which the major part, more precisely at least 1,300 hours, shall take place at the training institution. And that can be either the hospital, the long-term care facility, the pediatric care unit. Another new facet is the standardized vocational qualification with a certificate which enables to all professional fields, as I said in the beginning, in the nursing sector. That means acute care as well as long-term care, we will have more flexibility in that field. Now I come to the training contents. The training contents are autonomous and process-oriented nursing of people of all ages, young kids and elderly people. Starting point are the specific living conditions of the person in need of long-term care with his or her social and religious background. Distinction between duties to be performed autonomously and the autonomous performance of measures ordered by a physician. Competence-based specification of the skills and imparting of necessary learning competences, lifelong learning. An important component of the reform is the revised funding of the training. In this respect, it is particularly important that the new funding system will not involve a capping of training figures. People criticizing the reform, they said, well, it's a new good funding system, but you will have a cap. But we will not. So it will get more expensive if we have more people doing the training. The new nursing training will be free of charge for all trainees throughout Germany. In particular, the training institutions and schools in the sector of traditional geriatric care will benefit significantly from the new funding system, and the trainee will get a salary, so they have to live off something. Crucial for the training companies is, in future, providing a training will no longer be a competitive disadvantage. Thus far, this has been frequently the case for the training institutions in geriatric care. Consequently, geriatric care also benefits in this respect. In particular, we will also involve the institutions which do not provide training in the funding of the new nursing training. So that means institutions which do the training, they are not more expensive than institutions who don't, because they get the money back they need for the training, and the others have to pay as well. This is possible since the new nursing training will be financed through training funds at federal Länder level. Besides the previous funding parties, even the institutions which do not provide training, as I said, will have to contribute to these funds. Overall costs of about 2.7 billion euros per year. Additional costs will amount to around about 322 million per year. Oops. We are seeking to supplement the generalist nursing training with the option of generalist nursing studies. For the first time, we will introduce nationally standardized regulations for nursing studies. The nursing studies will qualify students for the direct nursing of people, as does the vocational training, however, with an extended training goal. Prerequisite for the studies will be the higher education entrance qualification. The higher education training will also address nursing personnel who, after several years in practice, seek further professional development. And that means we are building a career for people doing nursing. They can, in the end, they can go to university. The nursing studies will also comprise practical work and will be completed with a conferral of corresponding academic titles and at the same time the state exam. Now I come to entering into force. The reform is still being discussed in Parliament since several months. It's quite a tense discussion, and the bill, we hope, will hopefully the training will hopefully start in 2018. This requires further preparations, also after the entering into force of the regulation. We are convinced that this reform will modernize the profession and will attract more young people to pick up the training. Thank you.
Great. Thank you very much, gentlemen. It's great to end up with some good news, isn't it? Now, have people got questions? There is a mic, but where has it gone? Have you got the microphone? Anybody seen a microphone? There isn't one. Okay, so people with loud voices, or find a friend, if you would like to ask a question, that would either to Tim or Matthias or both, we've got a few minutes for that. So I see a hand up there. Yes, do you want to shout?
I'll try. I hope I'm loud enough. I have a question, sorry, about the funding. If I understand correctly, there are three parts to this reform. One is the training, the other what would be the expected change in the cost of services, professional skills, and the third is the juggling between work and personal family issues, meaning the time to leave, 6 months, etc. That would probably also have a cost. I'd like to know what was the anticipated cost of these three parts of the reform.
Well, as I said, the cost of those are two different laws I was talking about. The one is the nursing training law, and the other one is the caregiving leave law. And the caregiving leave law, that doesn't cost much because they get a loan and they have to pay it back, and they get paid for the 10 days. That's round about roughly something like I think round about 20 million euros, 20 to 30 million euros a year. So because it has started last year, so we have implemented it, but it started last year, and people are picking it up. We'll see in the future the cost. And the reform of the fund of the training, as I said, overall cost of about 2.7 billion euros a year, with including additional costs of around about 322 million per year. So it's quite expensive, but I mean we've got to do something about it.
Does that include the expected
Salaries for the trainees? Yeah.
Not only the salary of the trainees, but what expected to be the wages afterwards? Because
No. That's different. That's financed by the long-term care law.
The reform itself.
Yeah. The reform Professor Rothgang was talking about.
That there's going to be expected higher wages?
Yeah, we expect higher wages in the future because they are trained on the same level. So that means if they work in the hospital on a long-term care facility, they've got the same training, and so the institutions can't pay them different. They can't pay them different wages.
Right. So thank you. We've got a question there, and then Bernadette Brandt. Yes.
Rather two remarks. One concerning Tim, concerning the role of pay. And I think we must not underestimate payment for recruiting people, because what we quite often read is that there have been surveys, and you ask people who are in the job, how important is payment? They say, well, it's not that important. But that's not the target group. We have to ask people who are not in the job, particularly men. And I think then payment does have a real role to play. And if I talk to an ordinary economist, he would say, what's the problem? You know, you have demand, short supply, so the price would go up. But that's not working in the sector, because the services that employ those people get a remuneration, and they are refunded. And the institution that fund that, they only have a limited amount of money. That means if the pay has to go up, the prices for the services has to go up, and the funding for insurances or whatever has to go up. And that's a long chain, and I think that's what we have to focus on. And just one remark, Matthias, concerning the care leave. You said it started in January 2015, and it sounds good, but I think the utilization is very poor. As far as I know, the last figures, the ministry is not counting those who take the care leave, but you count the number of people who get the loan. And the figure for 2015 was a three-digit number. There were 250 people in the whole republic who take this loan.
Gotta say
Maybe we have newer figures and better news, but I think it's a problem, because I think the idea is good, but the utilization is very poor.
Right.
I have to say something. Well, you're right. You're right with the 100 or 200 or 300 people getting the loan. But there are roundabout. We have new figures. There are roundabout at least 30,000 people taking the leave from work without payment. So that's a lot. So that means that those are new, very new figures we are going to publish in a month's time. So, and the people taking the 10 days, they're around about 15,000. There were 15,000 last year. So I think that shows us that people need some support like the Caregiving Leave Act. Even though you're right, the loan doesn't work. So, and in the next coalition period, we have to think about it, and we have to work on it. And I think it has to be changed. You're right.
Okay, Tim, did you want to comment on that?
Just really that I agree. So if I ask my friend who who gave me the story about people leaving for little. The reason that people are leaving, in his view, is because they had their wages cut. And the reason they had their wages cut is because the local authority wouldn't pay as much for care. And the reason the local authority wouldn't pay as much for care is because the Treasury was taking their funding away. So it does come down to that. If you cut people's wages, they're going to not be so keen to work in the job. So the reason I was focusing more on the other things, I suppose, wasn't that I don't think pay rises will work. I just think in some countries it might not be realistic that the Treasury Department is going to stick their hand in their pocket in the short term.
Okay, so Bernard.
I'm interested by the new funding arrangement for training in Germany and a pooled funding with a levy and some kind of payback to those who train. The government in this country has just instituted something rather similar, not for the care sector specifically, but for vocational training and apprenticeship training in general. But with an exemption so that small employers do not contribute. It's big employers only who contribute. And the problem seems to me here is that those who don't contribute are in fact the very sectors who actually free ride on the training that is done by others. Now, I don't know enough about what has happened in Germany recently with respect to this reform, but are there exemptions or does everybody have to participate in this? And if it is the case, do you know whether it is the small employers who train or the big employers who train, and who is actually going to bear the cost of training after the levy has been introduced?
Well, everybody has to participate. There's no exemption. There's no exemption in the LTC sector. Every institution, outpatient care institution, inpatient care institutions, has to participate. And a company which does training, they get refunded for the trainees, for the wages, and for everything.
But we know very well that in Germany a lot of the small firm sector doesn't train. We also know that, that the social care sector in particular in Germany is comprised of a very large number of very small firms or organisations. Do these people currently do any training, or are they actually free riding off the training of somebody else?
Many of them are free riding, some of them are, but in the future there's no, as I said, there will not be an exemption. Right. So they have to pay.
Thank you. We've got time for one more question. Gentlemen, at the end, are you going to tell us some room directions shortly or not? Yeah. Okay. Lady there.
Yeah, thank you. I think the discussion is missing also a very important point, and that's the organisation of care work. Because for a number of years we've had very harsh public management reforms in a number of countries. And when we ask care workers, they say this is the lack of independence in organising the work, the mistrust in regards to how they perform their work and so on. And I think we need to move in another direction where we trust these care workers more. Formal education is one thing, but also making them able to work with, for instance, occupational therapists and so on. Reablement, which is introduced in Denmark and Norway, you mentioned push-up, is very important. I think it's a step forward in this way, opening up for actually the care worker and the care recipient to negotiate more themselves about what care work is needed.
Okay, Matthias.
I think you're completely right, and that's why we have reserved tasks by law. That means that it's a reserved task for nurses, and even physicians are not allowed to do it. So I think it goes into the same direction as you're mentioning it.
Right. Okay, so thanks very much, everybody. Thank you in particular to our speakers. Shall we give them a round of applause?